effort for restoration of the mental health add-on. It should have been part of that payroll tax holiday that was extended. It wasn't. It's regrettable. We'll continue to work. I want to work on that because it's going to deny access to Medicare beneficiaries, and that's unacceptable. As we know, many times the Medicare model is looked at by the private sector market. And so we have to make certain that with the best wisdom, we're inserting the sort of tools that, and policies and resources that best advise the system and move it forward and build it stronger. The passage of the Wellstone-Domenici Act, the Mental Health and Addiction Parity Law, was an important investment. It was one that brought about unprecedented help to our mental health community. It is one that brought about long overdue justice and one that spoke to social and economic justice in noble measure. And so that was a victory. It was a climb to the summit. We made it to the mountaintop, but that's only the beginning of the story. If we see that as the end, we will fall short. The fight is yet to come to make certain that we somehow move forward with the insurance industry and make certain that they incorporate the spirit and letter of the law to the fullest measure. It is absolutely essential. You know, it's interesting. I began my day today in my district because we're home for district work period. And I sat down on behalf of flood victims that were far too many to count in my district, devastated by Irene and Lee this past summer. Many lost everything they owned, everything. And the insurance representatives were in a roundtable discussion with us. And you know, I had to listen to the denial, the rejection, the semantics that came into play to just avoid making payments where people have made them for 25 years and now they wanted to draw down and they were getting a sad story in return. And interestingly, here tonight, I end my day with a discussion on insurance fairness. You know, just the fact that there are still those companies out there that if they have their free reign will limit treatment, limit visits, limit all sorts of opportunity. Unacceptable, denying hope. They also will make you dig in deeper to your pocket, and they will also talk about deductibles and all of the co-payments that really drive down the opportunity. They will exclude, in many cases, coverage for residential treatment, while they will give general health care a full reign for residential. Unacceptable. Stepchilding a process that should be a thing of the far distant past. Picking and choosing what kind of inpatient programming will be essential or available for those who struggle with chemical dependency, addiction, or mental illness or mental health disorders, while giving all other medical inpatient care a green light. And then also the pre-authorization that has fallen upon many, where in order to get your outpatient care, the pre-authorization is a roadblock, not allowing for good opportunity to come to the way of your patient load. That is all what should drive us now to make certain that the implementation is as sound as it can be and as passionate a resolve by those of us on the Hill here in Washington. Just last year, I, along with many colleagues, signed on to a letter that spoke to parity for the substance abuse community. Working with, absolutely applaud, because that was a letter driven that we did with co-chair John Sullivan, a Republican, as many of you might know, from Oklahoma. We signed on to the letter, we kept pushing, we've worked with Gracie Napolitano as another person who's with the leadership of Mental Health Caucus, making certain that however we can communicate in letter form, written form, conversations, we want to let people know we're watching and we're not going to stop until the implementation is as noble as it can be, as bold as it can be. So the work continues. We need to make certain that we go forward because there are too many gray areas that insurance companies are trying to exploit in order to avoid investing where they ought to and allowing the profit margin to grow higher at the expense of people who live in pain every day. Unacceptable outcome. We're going to continue to work to make certain that parity laws will guarantee access and affordability for the great population out there. You know, another victory of which we speak, one of which we share great joy, getting to the mountaintop again, was dealing with the essential health benefit situation. Making certain that we inserted into that discussion and definition many of the programs for which you do battle, programs that you provide essential services. That essential health benefit has been broadened. That's okay. But now we have to make certain that the interpretation of all of that work is as broad and deep and as forceful as possible. I don't want to hear this narrowest of definitions. We want to make certain that the essential health benefits are those that will provide the clinician the opportunity to address someone's pain, to cure someone's situation, and to make certain that there is success again in the package, and to move forward with the full continuum of care that people deserve. And so I want to make certain that we make a push for the definitions that will provide these services and make certain that each petition to receive treatment is done under appropriate and effective measure. Then and only then will the essential health benefits truly be essential health benefits. A lot of work to be done. Now, as many of you know, all of you know, the 2013 budget is upon us. Discussions are up and running on the Hill. And, you know, there's good news, bad news. I'm disappointed that there are cuts to the SAMHSA funding. But pleased, at least, that we start with no cuts to the mental health services block grants. But we've got a lot of work to do in this area. I want to make certain that the $150 million cut proposed for SAMHSA is wiped out, that we deal with it in virtual true terms so that we're providing people the resources they need to